With the passage by the Senate of the National Health Care Bill, it's a certainty that the House will pass this bill. And in that bill is incorporated the pathways to biosimilars, which used to be a separate bill and was incorporated into the National Health Care Bill. And with the passage of the biosimilars part of it, we'll get generic versions of biologic drugs which heretofore haven't been able to be made. But much, much more important than that will be a revolutionary new way of making the biologics that will be vastly cheaper. They'll make new biologics this way. They'll make patent-expired biologics this way. It's in the egg whites of chickens, and it's been worked on and overdue for 20 years plus. And the company that's been set up by the industry to do this is called Synergiva. It used to be Avigenics. They have everything ready to go. And this will be a vastly much, maybe 1,000th the cost. I'm sure they're not going to charge that a little for them, but there was a biologic came out that's going to be launched in January that costs $30,000 a month, that only reduces tumors by 27%. I mean, $30,000 a month, $360,000 a year, and there are others that are well over $100,000 a year. No longer can continue this way. So the new method will be part of the National Health Care Bill. Why that won't ever be a eureka moment is because those people still taking biologics that are patent protected will still be paying the exorbitant cost. And after the passage of the passage in the Senate of this National Health Care Bill, and since the biologics will be made in the egg whites of chickens, Cal-Maine Foods, which is the largest public egg producer, has had a nice rise in their stock price. And also, since biologics are almost all injectables, a company called Hospira has also had a nice rise since then. They do injectable generic drugs, so that's what the biologics are going to be, injectable generic biologics. So Hospira has also gone up because of this. And even though this is pretty much on the horizon, it looks like the National Health Care Bill will be signed within a month, that who's talking about that there's even a new way of making these drugs. And since to make these drugs as they are made now, you need to build plants that take 5 or 6 years to build, cost $1 billion to build them, and all the other incorporated problems it has to make these drugs the most expensive things to make anywhere, anytime, ever. Well, since the beginning of 2007, there has been no building of new biologic manufacturing plants. So with 2/3 of what's in the pipeline of FDA approval being biologics now, and that they have to be ramped up according to Biogen IDEX site by 1,000-fold, well, where are they going to be? They're not building plants, and we need a 1,000-fold increase, and 2/3 of what's coming is biologics. What's wrong with that picture? Well, there's nothing wrong with it. A new method is going to be forthcoming, and it's revolutionary, but this is the only place you're going to read or hear about it. Why is that? See?